Good evening. This is Dr. Limon speaking in regards to patient number 337715. I will be summarizing Mr. Johnson's medical report. Mr. Johnson is a 28-year-old male who is 5 feet 11 inches tall and weighs approximately 165 pounds. This patient came into the facility on November 2nd, 2018. The patient was brought to the facility in a wheelchair. His mood was abnormal. He came in looking pale, sweaty, and had difficulty breathing. However, he was responsive and knew where he was. The patient claimed to have experienced an accidental knife wound on his thigh. A few days after the accident, the patient experienced inflammation of the wound, fever, chills, and difficulty breathing, and pain in the affected area. He claims he is unable to walk on his own and that his fever will not go away with over the counter pain relievers. The patient's vital signs are as follows: temperature is 101.2 degrees Fahrenheit. His pulse is 110 beats per minute. His blood pressure is 110/60. His heart rate is 110 beats per minute, which determines that he has tachycardia. Respiration is 40 breaths per minute. Abdominals, he has no abnormal findings during the palpation exam. Muscles, he experiences muscle stiffness where the wound occurred, which is in the rectus femoris muscle. Based on the patient's vital signs and symptoms, the patient appears to suffer from septicemia. We have performed blood tests to determine the amount of white blood cells in the blood, urine tests to search for any other possible health complications, and we have performed other tests for other specific infections that he might have. The treatment plan I suggested was antibiotics, fluid therapy, close monitoring of the patient, lung protective ventilation, and enteral feeding if necessary. The patient is not allergic to any medication. The final diagnosis, as was believed, was septicemia, a systemic inflammatory response resulting from infection or a bacterial blood infection, in this case resulting from the accidental knife wound that the patient experienced. It is a disorder of the cardiovascular system. Therefore, it is very important to keep monitoring the patient at all times. Septicemia can cause a cascade of events that can lead to organ failure. Please keep this patient in the observation unit.